Hey, so today I'm going to be talking about the VSD surgery. The topics that I'm going to cover today are: what is VSD, that is ventricular septal defect, what are the causes of VSD, what are the signs and symptoms of VSD, what are the treatment options and the surgery available for VSD, who are the best hospitals and surgeons for the VSD surgery in India, and what is the cost of a VSD surgery package in India. These are the important topics to be covered today. What is VSD? VSD is basically a hole in the two lower chambers of the heart. The wall that separates the two ventricles is called the ventricular septum, and if it is perforated, the condition is called as a ventricular septal defect. This is a congenital condition and is present from birth. This causes passage of blood from the left side to the right side of the heart and causes an extra load on the right ventricle. Now, what are the signs and symptoms of the VSD? Most children with small VSD defects will not have many symptoms, but children with bigger size defects will have very typical symptoms. The common ones are bluish face, specifically a lot of blueness around the lips and the cheeks area. Second is repeated infections and cough. Third is failure to thrive and able to put on weight, loss of appetite, being very restless, and catching repeated infections. These are the common symptoms. And also having fever, prolonged fevers that does not respond to common antibiotics. So these are the common signs of the VSD in children. What are the treatments for the VSD condition? If the VSD is very small and the child does not have many symptoms, then usually no treatment is advised, and it is expected that the VSD will close with age. As the child grows, a lot of small and tiny VSDs close. If the child has severe symptoms of CCF, that is congestive cardiac failure, then some medications would be advised, and the child's parents would be advised to undergo repeated dental checkups so that the child does not have any infections, and to look out for any untoward infections that do not respond to primary treatment. This is how the VSD is managed. In very severe cases, surgery is advised. We will be talking about the two surgery procedures. What are the surgery procedures advised for the VSD condition? The first one is a surgical closure in which the wall that separates the two ventricles is closed with the help of a tissue patch. This is called a VSD tissue closure surgery. It is usually advised for big size defects. Now, patients or children with small size defects are usually advised cardiac catheterization, in which a small device goes through the blood vessel, reaches the area of the heart, and the hole is closed with the help of a small device in a way where the two chambers of the heart are completely separated. So this is a non-surgical procedure. The choice of procedure would depend on the size of the VSD, and the surgeon would be able to advise you the best based on the investigations. What is the cost of the VSD heart surgery in India? The cost of the procedure will range from $4,000 to $6,000. The cost is dependent on basically four factors. What is the procedure advised, whether it's an open heart surgery or a cardiac catheterization? What is the expertise and the seniority of the pediatric surgeon operating on the baby? What is the brand reputation of the hospital? How well known is the hospital? What is the infrastructure in the hospital? And of course, finally, what is the room category that you select? The cost variation depends on the types of the room that you select. These are the important factors to consider. The range is $4,000 to $6,000. How to select the hospital and the surgeon best suited to handle your child's condition. When selecting a hospital, please check for the hospital's accreditation and the certification. Please check how is the hospital's reputation in managing such cases, what is the hospital's infrastructure, and what kind of paramedical team is there to take care of the post-operative care. These are very important factors. When selecting a surgeon, please check the educational qualification of the surgeon, the experience and the seniority of the surgeon, how many cases has the surgeon operated for similar conditions. So these are very important factors you should consider while selecting the hospital and surgeon for your child's surgery. I hope we have provided you with very good and vital information. If any of your loved ones or any of your relatives are looking for a similar surgery, please connect them with us and we will be very happy to guide them. Thank you.